Yes. Let's talk about what you need to know for the INBDE exam. So once again, this is Dr. Sutton. I am back with another 10-minute podcast to cover some very high yield information regarding the INBDE. Remember, these 10-minute talks are basically to talk about things that have appeared on the exam. These are things that are super high yield, so you want to pay attention to every single word. And of course, as I always say, if you want a more detailed explanation or to get involved in one of our online classes, always feel free to visit us at mdiprep.online. That's www.mdiprep.online. So let's jump right into today. So today we're going to be talking about, and remember, over 90% of the test on the INBDE are patient boxes. So they're going to give you some type of patient box, and they're going to put some information in there for you to identify what you need to know in order to answer the question. So today we're going to be talking about a patient that basically comes in, and they may describe this patient as having some type of neurological manifestations. The individual may have these sharp shooting pains that may be in the face, and that these sharp shooting electrical pains may be followed by some type of numbness in the facial area or some type of double vision or jaw weakness. And what they're looking for you to understand is that the answer, the diagnosis is going to be trigeminal neuralgia. They have asked this question on, I would say, over 80% of the exams so far, the INBDE exams. So the answer is going to be trigeminal neuralgia in terms of the diagnosis of the patient. The next thing they're going to want to know is, how do you treat it? Well, the way that you're going to treat it, what you're going to be looking for, the answer is carbamazepine. Let me repeat that. Carbamazepine is what you're going to be using to treat the trigeminal neuralgia. That is the first line treatment. Now, there are some second line treatments, but they're not going to ask you that on the exam. They just want to know if you understand the first line treatment. The next thing they're going to want to know is, do you understand the mechanism of action of carbamazepine? So carbamazepine is basically a sodium channel blocker. Now, if you're not familiar with sodium channel blockers, let's back up just a little bit, and I'll throw a little basic science in there just to give you some context so you'll understand the mechanism of action. So basically, in terms of a neuron, whenever a neuron gets excited, meaning that the inside of a cell, inside of the nerve cell, whenever it becomes more positive, that cell gets excited. And when that cell gets excited, it depolarizes. Depolarizes means that it's going to cause an action potential to fire. Now, think of it this way. If that action potential fires, it's going to travel down this axon. It's going to release some type of neurotransmitter that's going to cause a muscle contraction. That's what it does. That's what a sodium channel does. Basically, when the sodium channel opens up, the sodiums have a positive charge. That positive charge goes inside the cell. Once it's inside the cell, now the cell is excited. It fires an action potential. That action potential travels down that axon to this synaptic bulb. It releases a neurotransmitter and causes the muscles to contract. Now, that could be a muscle, or guess what? It could be some type of other neurotransmitter that can be released in the brain. So you may have heard of carbamazepines before when we talked about anticonvulsants. And if you think about a convulsion or a seizure, that's overexcitement in the brain. The brain is like super excited. So you got a lot of these electrical impulses and all of this activity going on in the brain. Why is all of that activity going on in the brain? Well, because that sodium is entering the cell is becoming positive, sending off the action potentials. Now that action potential is causing action, causing excitement. So if the problem is that there's too much excitement, then what do we want to do? Well, the thing that we want to do is we want to kind of slow down or stop that excitement, or actually inhibit that excitement. So what we use is the sodium channel blocker. Yeah, so guess what? If we block the sodium channel, that prevents the sodium from entering the cell, which decreases, or it doesn't cause that depolarization to happen. and that will help treat the trigeminal neuralgia. Now, while we're talking about anticonvulsants like carbamazepine, there's another question that's on the exam that they love to ask about. And this particular one is that they're going to talk about maybe a child who looks like they're daydreaming, or they're looking out the window and they just kind of appear. Maybe they have maybe a little of the lips may be smacking just a little bit, or they're blinking, but this looks like they're daydreaming. What they're trying to get the diagnosis, or what they're asking you to diagnose, is something called a petit mal seizure or an absence seizure. Now, again, they're going to ask you, what is the treatment? The preferred treatment for a petit mal seizure, or what we call absence seizure, is ethosuximide. Don't forget that. The answer for your exam is going to be ethosuximide. So there are two things we've talked about today. Don't forget, if they give you trigeminal neuralgia, the answer they're going to be looking for treatment is carbamazepine. If they ask you what is the mechanism of action for carbamazepine, it's a sodium channel blocker. If they give you the diagnosis of a young child, or if they give you a clinical presentation of a young child who appears to be daydreaming, just kind of looking out, staring, hadn't lost consciousness or anything like that, they want you to think about an absence seizure or a petit mal seizure. What is the treatment? That's right, ethosuximide. These are some of the questions. These are just a few of the questions that you probably will see on your exam. Now, again, we cover this in depth in our classes. Our classes are 3 months, and we cover everything, every bit of pharmacology, all of the subjects that are covered on the INBDE. We cover those in depth in our live online classes. But for today, all you need to know: trigeminal neuralgia, petit mal seizure. How do you treat it? What is the mechanism of action? Hope this was helpful, and hope to see you next time. This episode is brought to you by MDI Prep. MDI Prep is a course that specializes in helping students with the MCAT, PCAT, DAT, and INBDE exams. Since 2008, over 90% of MDI Prep students have been accepted into medical, dental, or pharmacy school programs. With affordable payment plans, MDI Prep takes the stress out of applying to programs and preparing for the test. That way you can stick to what's important, and that's passing your exam. To learn more, visit www.mdiprep.online. That's www.mdiprep.online, or call 1-888-827-9881.